Democratic Alliance calling for embassies to be built for foreign patients who are treated at the Gauteng hospitals. The official opposition says this is a practical way of addressing the issue of foreign patients overburdening hospitals. Here to unpack this more, I'm joined by DA Gauteng Shadow Health MEC Jack Bloom. We also have with us Dr. Mvuyisi Mzukwa, chairperson of the South African Medical Association. You're a part of the conversation tonight by sending through your comments and your questions. The number is 072-110-5584, or otherwise you can tweet us tonight at Newzroom 405. Good evening, gentlemen, and thank you very much for your time and joining us tonight on In Focus. Jack Bloom, let me start with you. The Minister now of Home Affairs saying when he was still Minister of Health back in 2013, right, he says he was confronted with the reality in one of the hospitals in Gauteng where the nurse said to him, 60% of the women in the antenatal care in that particular hospital were foreign nationals. So it's not a new problem. It's a problem that has been in existence. Why has this practical solution that you're saying could be pursued not been pursued up until this time?
Well, as you have pointed out, it's not a new problem. We've known this for some time, and I want to stress it's only one part of the problem of our health services. If I'm talking about Gauteng and specifically, you know, it's just been one scandal after another: wastage, corruption, mismanagement. But yes, it is a particular burden at particular hospitals. Not all hospitals and not all departments. And I recall in the Gauteng legislature some years ago that the provincial government said precisely this. They were going to build foreign embassies and recover money in that way, and obviously that would assist. So I'm currently asking questions of the Gauteng legislature. What happened to this proposal? It seems to me eminently sensible and reasonable. Are we going ahead with it? If not, why not?
How do you see it working out? I mean, practically in terms of how this invoice is going to be sent to the embassies?
Well, I think one of the problems is that we don't bill patients correctly. Our administration is not up to scratch, and I think that's part of the reason why it hasn't been implemented. You know, if you're going to send bills to foreign embassies, they've got to be accurate. But I also think that the national government has to actually basically contract a treaty with countries from where these patients come from. And I mean, the most logical place to start is with the SADC countries, the South African Development Community. That's all our neighboring countries. It's a giant customs union, and every year the South African government pays an enormous amount of money to surrounding countries. Now, I think they should just negotiate that we'll keep a tally and an accurate costing of how much it's costing to treat patients from the SADC countries, and then you just deduct it up front. I think that's a very practical way, but I think we've got to start speaking about this solution, but it can't just be done by a province on its own, is what I'm thinking. I think that the national government, if they're serious about it, should start negotiating with neighboring countries.
Yeah. And what would be the diplomatic implications of such a move? Firstly, I mean, is it practiced anywhere else in the world successfully? Would South Africa be learning from, I suppose, a relationship that is already existing, or will we be creating this new arrangement ourselves?
Well, yes, it does exist in other countries, but you have to formally establish it with the countries concerned. So I think there's a role here for national government. They must just negotiate a treaty with these countries, but we do need accurate figures. I think we get various figures that are tossed around: 60% at one hospital, 25% at another hospital. I think there's a particular issue with maternity patients. While I think the vast number of foreign patients at maternity units actually live in South Africa, some of them specifically come into the country to give birth. And that's an observation that I've heard from doctors and nurses. Now, I'm sure that the Medical Association will tell you that doctors and nurses are obliged by the Hippocratic Oath to treat everybody that comes their way. According to the Constitution, you can't turn anybody away. That's the legal aspect of this matter. And, what we have to do is look at a way of properly funding it. And the way you do that is to make an arrangement with the country concerned, have an accurate billing system, and send them a bill and enforce it.
Yeah. Dr. Mzukwa, let's bring you in here. I mean, firstly, the anecdotal recollection of the minister in his days as health minister, saying, he was told that 60% of those who were in the antenatal ward in one of the hospitals, I just didn't get the name here in Gauteng, were actually foreign nationals. Is that something that you would agree would be a possibility?
Good evening to you, Thabo and Mr. Bloom and your viewers. Look, as the Medical Association, we know that it is very much possible. But I think, like we had earlier discussions, and also our submissions to the Parliamentary Committee, Portfolio Committee on Health, on our oral presentations, we have made it clear that to solve this problem, we have to go the route of, having data that we must present to these surrounding countries, and also, have an arrangement, a formal arrangement of how we get compensated in terms of treating the patients that are coming from these countries. We also made a similar proposal to government. The other thing is that if you're blaming the influx of patients from other countries, you can't just use patients as scapegoats. They come to South Africa seeking help. And like Mr. Bloom was saying, as the South African Medical Association, and any doctor, even if you are not a SAMA member, any doctor knows you cannot chase a patient away. And the same thing that we have raised with the NHI bill, where it says that we are only going to be treating emergencies for people who are unregistered. To us, it doesn't matter. If you are in a hospital, all we need is present yourself and we are going to treat you. But we ask ourselves, who is going to be this thing of checking who is legal, who is not legal? Because if there's a patient in front of us, we are going to treat that patient. It's Home Affairs must do their work. All these government entities that are supposed to be working on documentation and stuff like that, they must do their work. We are not working under Home Affairs. We are not trained to do that. Ours is to treat a patient that is before us. So you can't be blaming these patients. You must be blaming yourselves as government or blaming other governments. You must have that bilateral talks to make that arrangement. So this using patients as scapegoats, I don't know. Blaming, who doesn't know that we have lots of foreign nationals? But what are you doing about it? Why sing about it? We expect you as a responsible government to be doing something about, that issue. But with clinicians, we are clear we are going to see patients regardless of their status in the country.
Yeah. I suppose the big issue here, point of argument, is probably not so much that as clinicians, you, of course, are doing your obligations to treat patients, but it's the question of whether or not your assessment is that the numbers are overburdening the South African health system. I know it's a very difficult question to ask because you also do not determine where you're from. You don't ask them their nationality, but how are you to tell really this data is accurate to say there is an overburdening of the South African health system?
Well, what we are saying is that, the system is overburdened not only by influx of foreign nationals, but because there's also shortages of human resource. I mean, you know that there's shortages of doctors and shortages of nurses. So how do you determine that, that influx or that overburdening of the system is caused by foreign nationals or by our internal shortages? So I think there should be, making sure that the system is capacitated, making sure that we have enough doctors, we have enough nurses, all healthcare workers, in the institutions. And then we can talk about whether there's an influx of foreign nationals. We don't know. As doctors, we don't know. We don't ask that question. All we ask, if we do ask about, we want to talk about travel history. If we want to know, we suspect malaria and we suspect this, so we're going to ask about questions around that. But whether you are here legally or not, it's none of our business.
Will it be within your domain as clinicians to be able to collate a bill that will be sent to the embassies?
Nope. We have done enough of administrative work as clinicians, where if we were to do that for government, then we are not going to be seeing patients. It's administrative work, and clinicians must not be burdened with administrative work. Even now, we're doing a lot of that. At times you find that you're working in a hospital, you can't find a bed because there are many patients that need to be admitted. But that burden is left upon the clinician to be phoning around looking for a bed in other hospitals. We are tired of that. We can't do administrative work for government. We're going to stick to our clinical work.
So, I mean, if indeed this practical way of a solution that is being suggested by the opposition was to be implemented, what do you suggest would be a way? I mean, do you say government must send staff who will come and sit at the hospitals and do the chasing of the bill?
Remember, what we do as clinicians, we see a patient who's got a file already. So that work will have to be done by, there should be staff members who are doing that, at an administrative level. But when it comes to us, you can't be telling us to collect information regarding, whether this patient is a foreign national or not. We refuse to be part of that engagement. The government must find a way, they must find staff to do that, but not clinicians. It's not a clinical work.
There are reciprocal healthcare agreements, for example, that you can look at in the United Kingdom, right, between two countries where an arrangement is made, for example, that a citizen who is temporary in a particular country may be eligible to, for example, certain treatments, and there's a criteria that is outlined. So certain medical conditions would be permitted to be treated within public institutions, which means that you will get for free. Anything over that, which is not covered, you pay for, or something of that nature. And that becomes almost an exchange between the two countries that are involved. Is something like that administratively possible to be carried out here on the continent?
Well, I think it certainly has to be looked at, and I'd like to see some movement on that. But just to reiterate a point made by the South African Medical Association, our whole health system is under stress, and it's not just because of foreign patients. The Gauteng Health Department should have built probably another 5 more hospitals to cope with the natural population increase and the increase of people from other provinces. In the last 20 years, Gauteng's population has doubled, and most of that was from neighboring provinces or natural increase. So we shouldn't be scapegoating foreign patients. We should be looking at why we have vacancies for doctors and nurses, why we haven't built new hospitals in Gauteng, and why so much money is wasted. I estimate that about 2 billion rand of money that was made available for the COVID-19 pandemic was just stolen, wasted, misspent, mismanaged, and why don't we use the resources that we have properly? And we should think reasonably and rationally and conclude an agreement with neighboring countries, as they do have overseas. And you've cited one example. It's one way of generating revenue, but it shouldn't detract from the broader problems of our health system. I mean, it's scandalous what happens at our hospitals. The video that was circulated was a pregnant woman at the Rahima Musa hospital, mother and child hospital. I can tell you that down the road from that hospital, the Helen Joseph Hospital, you've got casualty patients who are sleeping on the floor in the corridors for days until they're admitted to wards. And most of the reason for that is because the Sharpenkreke Johannesburg Hospital is still partially closed. And this is another reason why there's extra patients at Rahima Musa, because of the continued closure of Sharpenkreke Johannesburg Hospital, which is an absolute scandal. So I think that government should not be let off the hook for not fixing up our health system, even though the budget is there. Gauteng health budget is 60 billion rand. That is far larger than a number of provinces. The whole city of Cape Town runs on a budget of 60 billion rand. So I think that if they spent that efficiently and effectively, we have a much better health system. But yes, we do need to look at source of revenue and concluding agreements with countries where we treat their patients makes a lot of sense. I'd like to see some progress in that area.
Looking at and assessing, I suppose, the state of our systems here in public service under general, do you think we will have the administrative capacity to be able to pull off something of this nature?
Well, that's another part of the problem, and again, it's because of mismanagement. We should have costing system. I think one of the major reasons why we have so much wastage and mismanagement and theft is because they don't have these systems. In Gauteng, they've been promising to have an electronic management system for more than 20 years. They were going to put one in about 12 years ago. That was under former MEC Brian Klongwa, and of course that became a huge scandal, and it still hasn't appeared in court yet. We're waiting for that. We should have an electronic management system which make lives much easier for doctors and nurses. I agree with the South African Medical Association. Medical professionals should not have to do administrative work. And the way forward is to have an electronic management system, electronic files. Medical staff will tell you that patients arrive there and paper files are going missing. I mean, this is an impossible situation. So what we need to do is modernize our health system, and that would go a long way to having an accurate costing system. Then you know what things are actually costing. And when you know what things are actually costing, you can direct money much more effectively in that area. And you can probably also pick up where all the wastage and corruption is happening. So, I think that there are so many things wrong with our hospital system that government needs to fix, and treating large numbers of foreign patients is just one of them. And if we use the budget effectively, I think we could give much better treatment to all patients who are in our hospitals.
I suppose the other elephant in the room, the big issue that we need to address, is the fact that the reason why some of these patients are here in South Africa, it's because the economies of the countries where they come from are really not that strong or even that stable to the point that embassies would want to engage in such reciprocal agreements or healthcare arrangements, because those countries just don't have the money to be able to boost their own healthcare system, never mind saying we'll now go into an arrangement with South Africa that we will pay them so much for the 1 million or 3 million people who are sitting in their country.
Well, that certainly is an issue, but as I explained earlier, we have the SADC countries, and South Africa could just deduct money up front from the custom duties that they pay over every year. But look, at least government should be thinking this way. Government should be exploring all the possibilities. Shouldn't have to be reactive. It has been touted before in Gauteng that they are going to build embassies. Well, I want to know what progress has been made in this area. We need to explore alternative revenue streams and mostly, I think, spend the money that we've got effectively as well.
Dr. Mzukwa, do you think a reciprocal healthcare arrangement of this nature or any other nature maybe could possibly strengthen international healthcare cooperation between South Africa and other countries?
In the best interest of the country to do so, engaging with other countries. I mean, even now, isn't that we're talking about universal health coverage? That is a global agenda that is driven by the World Health Organization. And I think it is in the best interest of the continent as well to start doing that, not only for South Africa, but also for other countries. Because like you said now, it doesn't, assist. It really doesn't assist to have just, making sure that our systems are working and we ignore other systems around us. If those systems are broken, they are going to impact negatively on South Africa. So it is in the best interest of the country to have those discussions with surrounding countries. Where we get patients that are coming to South Africa, there must be that, arrangement. And it should not delay anymore. That should be done like yesterday. It's a solution that is much needed because it has this impact that we are observing now. Though, like I said earlier, we are not blaming nationals. We are just blaming a collapsing healthcare system in the country.
Yeah. And I think that's a very important point that you are raising and that you're making. I think Jack Bloom is also in agreement with you on that. For many who are raising this issue of the overburdening of the South African health system, they are saying it is foreign nationals who are doing that. And I think what you're saying here tonight is that the system is overburdened all by itself. Whether you add in the foreign nationals or not, the system would still remain overburdened. You would still need more doctors. You would still need more resources. You will still need more beds in South African hospitals in general.
Very true. I mean, a long time ago, the South African Medical Association has been making presentations. We even, at some point in KwaZulu-Natal, 2017, in KwaZulu-Natal, the South African Medical Association had a march, a protest march, where the association was complaining about the collapsing service in KwaZulu-Natal, in all the hospitals, including, some respected hospitals like Inkosi Albert Luthuli, where there was an issue of cancer patients who are left stranded. So it's not a new thing. It's not a new phenomenon that we have a problem, in the healthcare sector. I mean, if you have broken machinery, the system, has no infrastructure that can support, service delivery. So how do you honestly blame foreign nationals? I mean, we've been having this problem since long time ago. And in 2018, there was a summit, a presidential summit, that came up with the presidential compact. And that compact is still a work in progress. It is in those solutions that we should be looking at how we capacitate the system, those human resource for health plans that must be implemented. So, to be going out there and just be pointing out one issue of foreign nationals, I think it's just a scapegoating.
Yeah. Jack, here's an issue that I think would probably be a political hot potato in you bringing this, because you're saying you are going to certainly be asking this question. One of the things that politicians would say is to say, which embassies are you going to go to? Are you going to go to the United States Embassy? They're going to tell you, we're not overburdening your system, so no one has an agreement with you. You're going to go to the UK Embassy. Which embassy are you going to go to? And therefore, the direction in which you are pointing the embassies that need to be engaged will in itself raise a political question, don't you think? Jack Bloom?
Yes, sorry, I didn't know you were directed to me. Look, we must obviously identify the patients, where they come from, and get some movement on this. What we've heard from the South African Medical Association, that proposals have been made. I certainly know in Gauteng that they've been talking about it. So what are they doing? And clearly, most of the patients are from the African continent. We used to chair the African Union. We obviously play a leading role in the AU and the South African development community. So we must take the lead there and see where it goes. But if we don't get the ball moving, how do we know what we'll be able to achieve? And I just see a lack of will to move forward on this. And again, I must reiterate, along with the South African Medical Association, we have a health system in crisis in general. So let's not just focus on this one particular issue. Let's look at the total system.